Good evening. I'm Dr. Melissa Green. I'm a licensed clinical psychologist and registered yoga teacher. Tonight, I'm going to talk a little bit about mindfulness and how you can use that as a way of managing stress. I'm speaking particularly to those people who have loved ones with dementia that they're caring for, but these strategies really can be used for anyone. When I talk about mindfulness, what I'm referring to is being aware of the present moment without judgment, with curiosity. And it sounds very simplistic, and I believe I may have mentioned this a little in my talk on the mind-body connection a few weeks ago. It does sound very simplistic, however, it's challenging for many people to practice mindfulness. So there's a lot of research that's out there now that talks about the benefits of mindfulness for lots of different things, for stress and anxiety and attention. And there is a program, mindfulness-based stress reduction program, where there's specifically been research done with that program, and they have seen benefits from practicing mindfulness in as little as 8 weeks. And what they notice is actually that there are changes within the structure of the brain. Many people are anxious about practicing mindfulness because they think that it's really difficult, or that you have to completely block out all the thoughts, which is really impossible, or they think that you have to have a lot of time in order to be able to practice mindfulness. But the reality is that there are ways that you can informally practice mindfulness, even if you're doing things like eating or brushing your teeth, which probably sounds odd if you're not used to practicing mindfulness. But the goal, again, of mindfulness is just to be in the present moment. Oftentimes, we spend a lot of time and energy rehashing things from the past, which can lead to us feeling down or depressed, or we're rehearsing things that we anticipate are going to happen in the future, which could lead to worrying and anxiety. Now, obviously, you do want to think about things that may have happened in the past, because you may be able to learn something from that, but you don't want to get stuck there. And you also want to think about things that may happen in the future, but you don't want to perseverate over those things to the point that you're worrying about it. So practicing mindfulness helps you to come back to the present moment, particularly if you're noticing that your thoughts are really focused on something that's creating stress for you. So I'm going to spend most of the time today just showing you 4 simple practices that you can do anywhere, really, and anytime, and no one would even notice that you're doing it. 2 of them involve your hands. I'm going to hold my hands up in the camera's view, but you actually don't have to have your hands up when you're doing it, but I'm going to hold my hands up just for the sake of you being able to see what I'm doing. So the first one is called finger breathing. And what you would do is you would take the tip of your thumb and start here and just outline your fingers. And when you get to the fingertips, you would press the fingertip. But as you're outlining, you're inhaling and you're exhaling. So the breath is very important in mindfulness. If you don't have any other thing to focus your attention on, like your hands, or sometimes people will look at candles when they're practicing mindfulness, then you will be instructed to focus on your breath. And with this practice that I'm going to show you, the finger breathing, you're inhaling and exhaling as you're outlining your fingers. So you would begin like this, and as you inhale, 2, 3, 4 counts, then you press your fingertip together, and then you come down as you exhale for 4 counts. Again, inhale, press your fingertips together, exhale, inhale, and press your fingertips together, exhale, inhale again, press your fingertips together, and then you exhale, come back down. And you can repeat that as many times as you like. It's a very simple practice, a very simple way of becoming centered, focusing on the breath. And again, you can do it very discreetly. You can have your hand in your lap. I'm holding my hand up just for the purposes of demonstration to show you how to do that. Another mindfulness practice that you can do when you're starting to feel stressed and you need to just center yourself. It also involves the hand. It's called high five breathing. So instead of using the thumb to outline your finger, you would use the finger on your opposite hand, starting down here. And it's the same. Whoops. My phone twisted. Okay. It's the same concept. You would inhale for 4 counts. Exhale for 4 counts. Inhale for 4 counts. Exhale for 4 counts. Inhale for 4 counts. Exhale. Inhale. Exhale. And then again, inhale and exhale. And then you're back here. And you can repeat that as many times as you feel necessary to help to calm you, help you to relax. Again, it's very simple, and there's lots of research on mindfulness and the benefits of it helping you to be able to manage stress and actually resulting in physiological changes in the brain if you do it on a regular basis. And what I probably should have said in the beginning is that as I mentioned, that you don't have to have a lot of time to practice mindfulness. You can take 5 minutes and do this exercise, or you could do that exercise for 10 minutes. Ideally, you would want to establish a time and place. And good evening, Lavon. Sorry, I see that you said good evening. Ideally, you would want to establish a time and place, and if you want to do it like every day, or if you want to do it, every other day or 3 days a week, but have a routine and a place where you would actually go and do it. And is it going to be first thing in the morning, or at the end of the day, or during your lunchtime? But establishing a routine will help you to be able to incorporate mindfulness into your day. Also, once you start incorporating into your day on a regular basis, and not just when you're feeling stressed, it will be easier for you to use it when you do feel stressed. So those were two practices, finger breathing and high five breathing. The next thing that I want to talk to you about as far as a strategy that is considered to be a grounding exercise or a mindfulness exercise, it is called the 5-4-3-2-1 technique. So again, usually we spend a lot of time focusing on things that have happened in the past or worrying about things that may happen. And usually those things are a source of stress for us. So in order to stop those thoughts, we want to bring ourselves back into the present moment. And one way to do that is to engage all of your senses. And that's what the 5-4-3-2-1 technique does. So what you would do is identify 5 things that you can see. So look around the room, or if you're outside, wherever you are, identify 5 things that you can see and actually name them. And you can name them out loud or to yourself if you're out in public and you're doing this activity, and name them. Then I want you to name 4 things that you can touch. So things that are actually within your reach. What are those 4 things that you can touch? Then you would name 3 things that you can hear. And sometimes you have to really focus on that because we tune out a lot of things that we maybe hear all the time, things that are like, I have this heater going on and it's just kind of background noise. But if I'm focusing on the sounds that I hear in the environment, then that's something that I probably would notice more than I do on a regular basis because it's always going. And then you would identify 2 things that you can smell. And you may not be able to smell distinctly 2 things. You might have to walk around wherever you are to determine if there's some distinct fragrance or scent. And then the last one is 1 thing that you can taste. And if you're not able to taste anything at that moment, think about the last thing that you ate and describe that to yourself, what that was. So that's the 5-4-3-2-1 technique. Again, you're engaging all of your senses. If you're engaging all your senses, then you have to be focused on the present moment. You can't be focused on what may happen or what did happen already. And it's, again, a way of helping you to get centered. And then the last exercise that I wanted to tell you about is one called the PFAT assessment. And PFAT is an acronym, and it stands for, the P stands for physical signs or symptoms. So if you're noticing that you're getting stressed or anxious or angry or having some type of intense reaction, whether it's a physiological reaction with your body or that you're you're doing something that you may not normally do, this is a good way of helping you to become more aware of what those things are that trigger you to get upset. So the P is for what physical signs and symptoms are you noticing? So are you breathing heavily? Do you have tightness in your chest? Are your muscles tense? Do you have a headache or stomach ache? Usually when we are experiencing stress, or if we're anticipating something to be stressful, our bodies will let us know before it actually registers in our mind as a thought. So learning how to assess what's going on with your body can help you to better understand what's going on with you and what people or places or things that might be triggers for stress for you. So the P again is for physical signs and symptoms. So you would ask yourself, what are you noticing? The F is for feelings or emotions. What am I noticing about myself right now? Am I happy? Am I angry? Am I sad? The next letter is A, and that stands for appearance. So if someone were to walk in and see me right now, how do I appear to them? Do I look like I'm sad? Do I look like I'm angry? And then the T is for thoughts. What thoughts am I having? Am I thinking that I'm a bad person? Am I thinking that I'm a failure? Am I thinking that this is the best day of my life? What thoughts come up? So, using that PFAT assessment again is a good way of helping you to be more focused on what's going on in the moment and more focused on what's going on with you and in tune with what's going on with you and your body so that you can start to intervene earlier before things escalate to the point where you're getting upset. So in the case of caregiving, you may notice that the maybe with your loved one, you might notice that you have some type of physiological reaction. You might notice that you have certain thoughts, or every time you get ready to go to visit your loved one, or every time you leave. So the purpose of doing this PFAT assessment is to help you to recognize patterns that are going on so that you'll know what it is that you need to be prepared for, or at least try to prepare for. So if you notice that every time that you get ready to go to visit this loved one that you either have to care for or that you're just going to visit, that you start to feel tightness in your chest, then in the future when you get ready to join sorry, I just got when you get ready to go in to see that person, you can do some things beforehand to prep you. So I'm getting something that Laban is. Are you asking to join the video, or was that not done intentionally? Um, and let me see. Let's see if I can bring her in. And I'm not sure if she was intentionally trying. So we'll see if she comes on. Um, so in summary, there are 4 practices that are simple practices that you can do. The finger breathing, the high five breathing, the PFAT assessment, and the 5, 4, 3, 2, 1 assessment. The not assessment, 5, 4, 3, 2, 1 grounding activity, which can help you to become more aware of what's going on with yourself and also help you to become more grounded and help you to be able to deal with stress a little better. So ideally, again, you would want to try to incorporate either that practice or a simple practice of just following your breath. I believe a couple weeks ago when I did the talk on mind body connection, I did a brief body scan. You could go back and listen to that and just kind of walk yourself through what exactly is going on in your body. Our bodies, they keep track of everything that's going on with us and everything that has gone on with us. And So becoming more attuned to what's going on with our bodies will help us be able to manage some of the things that may happen in the future. So that is it for tonight. Very short talk, but very helpful um, strategies that you can use, and very practical and simple that you can use when you start to feel stressed. The only other thing I want to mention is that I created a new resource this week. It is the top 6 secrets. I can't even remember what it is. The top 6 secrets for brain health and healthy aging. If you want that, you can get that for free. It is a PDF download. I will put the link in the comments below this video. Good night, Marilyn. So that's everybody's homework. Go practice those things until next week. All right. Goodbye.